In this video, I would like to share about healthcare costs. It's not only in China that it's very affordable. I'm a Malaysian. It's the same for Malaysia and also in Thailand. At least now it helps to clear my doubts because my mom had been sick for many years. This have led me to join into Facebook discussion groups where, of course, naturally, there are many people from America active in the groups. And often I hear them talk about things like insurance and Medicare, which I didn't understand. And sometimes when I actually watch YouTube video, I hear the American creators say about paying $800 for insurance every month when they are not working and they find it very hard to afford, and rent and food and groceries. So I was a bit puzzled, especially about the medical part. I didn't understand what it meant by needing to pay insurance to treat yourself. My mom herself is a nurse. Now she has Alzheimer's. She retired for more than 20 years. But before that, she was working as a registered nurse in a government hospital, serving the very poor community. During my mom's time as a nurse, she have actually worked in numerous wards. From what I remember, spinal ward, medical ward, maternity means she involved in delivery of babies. And finally, before her retirement, she worked in STD clinic. I would like to give you an insider view how it is like the cost of treatment. That's why for many of us Asian, we find it quite baffling when we hear about things like why people can't afford medical care. So now at least I hear people talking about it. I understand. But let me share what are the costs we are paying in Malaysia. Now in Malaysia, you have government and you have private hospitals. So of course, if you want to go to private, you have to pay premium fees, very expensive, the kind of fees. Normally people will pay that kind of fees. They normally claim insurance. Yes, that one we talk about insurance means we buy insurance. Why they want to buy insurance and go to private hospital where they can get in government for literally free? Reason being is that because the government, there's a long queue, maybe they're not happy, they feel the service is not up to par, they can afford, they will actually buy a lot of insurance. And when I was working, my company also paid for my medical charges and insurance. So all private hospital, I didn't have to pay as well. But for normal person, yes, they buy insurance so that they can afford private medical care because they don't want to go to the government hospital, which is often crowded because it's literally free. So what can we expect, right? My mom told me if they go to government hospital like outpatient, all this, my memory serves me, it is free. But if they go to specialized clinic, it's 5 ringgit. 5 ringgit means it's about $1.12 in US. As of January 2025, I Google it. It is around, let's say it's about $1. It includes the $1 in the government hospital specialized clinic. I'm talking about specialized clinic like ENT, not GP. GP, I think is free. But specialized clinic, ENT, STD, skin. So you just pay $5 ringgit, means about $1. You get consultation, examination, scans, and the specialized medicine. My mom worked in, as I mentioned before, she worked in the STD clinic. So the STD clinic, of course, you have people with HIV coming in for treatment. And I heard that HIV drugs are very expensive. But what these people need to do is to just pay 5 ringgit each time they come to see the doctor for the medication. If the appointment is every like 3 months or 6 months, then each time they come, they pay 5 ringgit. Then they get all the medicine for that duration before they come again. my mother was doing counseling for this patient, so she explained a lot. It's very pitiful. Their life is why they got the HIV. Everything is very pitiful. But anyway, this will be another story. Sometimes when they can't even afford, the doctor even waive the charges. They can sign off to waive so that the patient pays nothing. So this is for Malaysian citizen in a Malaysian government hospital. In Malaysian hospital, you have first class, second class, and third class ward. So the first class is air conditioned. You have with single bed, 2 beds, and 4 beds sharing. There are 3 types. And then the second class, that is actually air conditioned. Then you have the third class, which is non-air conditioned, and that's where my mother also spent a long time working in. So those wards are always full, and the treatment is actually free. When my mom retired, so she is also a pensioner, and pensioner, the treatment in government hospital, it will be free. Means my mother don't have to pay for medication for surgery. Now in Malaysia, if let's say you want to go, if you're going for basic treatment, it's affordable. But let's say if they need to go for advanced, then they probably have to pay a small amount, but it's still within something affordable. I'm not sure about how much of the amount, but I remember last time my mom said that for cancer, like for example, my mom have tonsil cancer. She went through an extensive treatment. She had tonsil cancer more than 20 years ago. She went through extensive treatment. Then that, she never had to pay a single cent for the treatment. But for other people, I remember her saying that they'll probably pay like 5 ringgit. Why people for cancer in Malaysia, why they don't want to go to government hospital is because there's a long waiting list. There's a long waiting list for ultrasound, for everything, since like the whole country is going there. But I guess the situation is improving because more and more hospitals, during my mom's time, there was not many hospitals, government hospitals around, but now almost in every town, they are opening government hospital, so the patients no longer have to come all over, go to Kuala Lumpur for treatment, go to the main city for treatment. They can treat at their own provinces, their own places. My mom said that if you don't have money, it's still affordable. Like let's say for example, cancer diagnosis. If a person suspects they have cancer, they don't want to wait because if appointment probably is going to be 3 months. Sometimes they are afraid it will spread. That's why because of that, people buy insurance to just cover for the expenses. I'm not a government staff. I don't have pension. Now I'm not working. I'm my mom's full-time caregiver. Have the assurance that if anything happen, I will be able to seek treatment in the government hospital. So whether or not, if let's say I got diagnosed and if it's a delay, I mean personally, it's just too bad. I don't mind. From the perspective of someone who is not a government staff, who is not entitled for free, like my mom, that kind of privileges. Actually, not really a lot of privileges. It's just for normal Malaysians, they just have to top up a bit more. If they want specialized medication, they have to pay. Whereas for my mom, she don't pay. Normal Malaysians, what we do is that we normally would buy insurance. Yes, we buy insurance. After I'm not working, the condition last time when I quit my job was I want to make sure my insurance were being covered, which is about few $100 a month because I bought from 2 insurance company. So why I kept those insurance even though I was not working is because my insurance policy, right, which I'm paying, they also put a portion for investment funds. These are not like Medicaid. I'm not sure Medicaid whether it's refundable or not, like in the US, but what we pay, right, is they take a portion. I bought those investment links insurance where they take a portion and they invest in. So when I bought the insurance, it was a long time ago. That time when market was when they just like kind of started this investment stuff. So over the years, because I was like an early adopter, the price of the stocks really, really went up. We went up so much that it actually, the cash surrender value for my policy is equivalent to the amount I'm paying. Means that if let's say I cancel my policy, I get back what I pay for. But if I'm paying, I get the coverage. You see, so that's why I continue paying, because of both policies the same. So when I surrender, if I don't surrender, I continue paying every month few hundred ringgit. Maybe to USD is only about $200-300 a month. If I continue paying, then when the policy expires due to my age, or when I choose to surrender the policy, means cancel the policy, I didn't default in payment, they will give me back like almost the total premium that I paid for. So that's why I still opted to have the insurance. This is how the private insurance here works. It is not to say that if you don't pay, then you don't get what people don't get medical coverage or what. They still get the medical coverage. And even though for government it's very affordable, for private, yes, it's expensive. Private, because with all the treatment, everything is getting more and more expensive. That I understand. For Malaysia, it's a bit expensive. In Thailand, I find that because we are now staying in Thailand, so I also end up staying in Thailand because of the medical for my mom as well. Even though we are foreigners, we have to pay, but it is still within affordable means. And I will probably talk about the medical costs in Thailand for foreigners in another post. But this has really something that, you see, the fact that when I was young, my mom have a qualification. Her nursing qualification was from the earlier batch. Means that when the Malaysian got independence from the British, from Britain, they have an arrangement whereby they will train the nurses in Malaysia. So my mom was actually in that batch. So when they train the nurses, they go under the UK syllabus. With the UK syllabus, and my mom had also the midwife certification, she could work anywhere. Her certification is recognized anywhere in the Commonwealth government, in Commonwealth countries. She's no longer, the new batch now no longer have that kind of, don't have the certification anymore. But during my mom's batch, she have. So there was many times that she actually contemplated to migrate to, before she was married, she actually almost went to UK. And then after, when we were teenagers, she contemplated either migrating to New Zealand or Australia. And then somehow it did. In a way, I'm thankful it didn't work out. I was not really thrilled with the idea. And in the end, because to migrate, she knew she had to go there first for a few years. And she was not comfortable leaving my brother and I under my father's care, because my father is basically, he is not as meticulous, I would say, as meticulous as how my mom looked after us. She's very particular. She watch over us. She watch our homework, everything. While my late dad is much more laid back. So in the end, she didn't follow through with the plan, because when we were early teenagers, she was worried at how we will become if we don't have proper guidance and training from a parent. So she gave up her dream. She didn't go. And I'm thankful, because who knows, we didn't know that right after my mom's retirement, just that after she retired and I came out to work, we wanted to, we couldn't afford like so much of things when she was working. She was trying to raise us with a very limited salary. We have grocery, everything, growing kids, school fees, and all these textbooks and stuff like that. So we couldn't afford much. So after we came out to work, we had these dreams of going to travel. I wanted to take her to travel and all she have never been to any like advanced country, any place. So I wanted to take her for traveling, but sadly, within a year after she stopped working, she was diagnosed with tonsil cancer. So when she got diagnosed, then she didn't travel. And from there, that was more than 20 years ago. And she had been sick on and off, glaucoma, liver cirrhosis, high blood pressure. Now she has Alzheimer's, and she had been bedridden and non-verbal and don't recognize me for more than 3.5 years. So all this involve a lot of medical costs, because the past 6 years, past almost more than 6 years, is 7 years, almost 7 years, we have been spending in Thailand as foreigners, paying foreigner pricing. And still, thankfully, I can still afford, even though we don't have, I'm relying on my mom's small pension, my savings, and my brother helping to support. My brother is just working, he is not his own business, he's just working with a very kind of like below average salary, and he's chipping in the cost. So we could still afford the treatment. Had my mom moved to like maybe a developed country, whereby the medical framework is very different, with the kind of host of illness and chronic, long-drawn illness that she has, she wouldn't be alive today. So that's all I could say about that. There's a difference. I'm sorry that this is the difference, how it is. And I'm sorry also I didn't understand how, because I just want to do this, but I just want to be very, when I see how Americans react about this medical, yeah, I also was quite surprised. Oh, isn't it what, I mean, it's like, isn't healthcare a kind of like birthright? So this is just my sharing and take on this. I really hope that medical could be made affordable, because health problem is something that everyone have, and it shouldn't be something that we work our butts off to save for that old age. Means there's nothing to fall back to. There's no like almost free affordable plan. Thank you.